Hi, I'm Dr. Paul Lynch with NevadaPain.com. Today I'm going to talk to you about an exciting procedure that we do here in our Las Vegas Procedure Center. This is called a percutaneous discectomy procedure. The percutaneous discectomy procedure is used for patients who have small bulges or herniated discs in their low back. This procedure works best for bulges or herniations that are between 6 and 10 millimeters in size. The idea of this procedure is the patient may not need a full surgical procedure, but instead can have a procedure where we decompress the disc in a minimally invasive procedure done with X-ray guidance. I'm going to walk you through a percutaneous discectomy procedure, and we are using a cadaver body today, so we won't be using all the same sterile techniques that you'd normally see, but I'm going to walk you through the procedure. I'm going to start off by explaining it on a spine model. What we're going to do in this procedure is we're going to make a small incision with a scalpel and then place a percutaneous trocar into the disc and decompress disc material from the disc. This procedure only takes out 1 to 3 cc's of disc material, but that's usually enough to decompress the nerve root at the associated level. We typically do this for patients who have a 6 to 10 millimeter herniation pushing on a nerve root with radicular symptoms in that distribution. We usually do a diagnostic nerve block first called a selective nerve root block, and if that takes away at least 50% of the patient's pain, then we know that this procedure has the ability to give them success. I'm going to go ahead and walk you through the procedure. We do this with X-ray guidance. This is an AP projection of the lumbar spine, and what you see here is the L4 vertebral body and the L5 vertebral body. I'm going to do this procedure at the L4-5 level. We go a little bit more. This is the perfect angle. I'll place my needle just lateral to the superior articular process at the L4-5 disc. By obliquing this far where the superior articular process bisects the vertebral body above, the nerve root is out of play, meaning there's less risk of injury to the nerve. Shot. 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 And shot. That's about the perfect place to put the needle. And go ahead and show the needle. I'll make a small incision with a scalpel and then place my needle through the scalpel incision. Shot. 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 You can go ahead and show the screen there as well. You can see the needle going directly towards where we were aiming, and now I can feel the needle going into the disc. At that point, I take another X-ray shot in a lateral projection. I now take the Stryker decompressor wand and I place it through the needle, and in a suctioning type action, it will remove disc material in a spinning motion. And then what happens is I will pass back and forth as I go live, will I? I'm watching with X-ray guidance as I go back and forth inside the disc to take out material. Go ahead and show the screen here. You can see my needle advancing and withdrawing as I make multiple passes through the disc. For more information about the percutaneous discectomy procedure or other procedures and conditions, check out NevadaPain.com. We change lives here.